Hi, Dr. Harrison here, and today I want to talk about the number one condition that I see in my office, and that is lower back pain. I think most people, when they think of going to the chiropractor, they're thinking, people go to the chiropractor because they have lower back pain. Actually, we see people for all types of conditions, ranging from headaches to neck pain, back pain, disc herniations, numbness, tingling, tendonitis in shoulders, knees, elbows, all these different conditions that we treat. But out of all of those, lower back is definitely number one. So today in this video, I want to talk about the different causes of lower back pain, how we identify those, and then how we go about treating them. So if you're watching this video, probably you're suffering with lower back pain, or you know somebody suffering with lower back pain, and I think you'll find this information very, very useful. So let's talk about the number one cause right off the bat. First thing that we do, obviously, is a good consultation, examination, orthopedic, and then we'll probably take some x-rays. We're obviously ruling out traumas and fractures and those types of things. When we get beyond that, usually it boils down to 4 different possibilities. Number one is just tight muscles and restricted mobility. Usually in this case, they're just going to have central, pretty localized lower back pain, and usually no pain in the legs or numbness or tingling. Usually it's just very simple low back pain. And on the x-ray, we'll find that everything is lined up perfectly normal, because all it is tight muscles and restricted mobility. So on the front view, everything would be stacked in a straight line. Nothing would be rotated or out of its normal position. On the side view, they'd have that normal curvature that we're supposed to have. They call that a lordosis. And so everything would look completely fine on the x-ray. When we see that, we know it's a pretty quick fix. We can get in there, work on increasing mobility, getting those muscles to relax, maybe with some therapy, muscle stim, heat or ice. Usually these people respond very, very quickly. 2, 3, 4 visits, maybe 6 to 8 at most, and they're back on their feet and out of the office. So very, very easy to treat. The second most common thing that we see, and a little bit more difficult to treat, is what we call a static subluxation. Well, what does that mean? Subluxation just means less than a dislocation. So it means the vertebrae is shifted enough to irritate the muscles and ligaments around the joint, but it's not actually dislocated. So on the x-ray, we'll find that one or more of the vertebrae is maybe rotated out of its normal position, and you can see that on the x-ray. Maybe one is laterally flexed because maybe the disc in between is swollen or irritated, and that vertebrae is assuming a more normal, or not a normal position, but what we call an antalgic position to take pressure off of the structures there that are causing pain. So many times those people will be listing or leaning to one side or the other, and they'll look in the mirror and see that they might be a little bit crooked. That way we know that they're in that second category. Those are a little more difficult to treat because now, along with the tight muscles and restricted mobility, we have that shift in the structure that we need to work on repositioning. So those cases, we might need a dozen treatments, sometimes even 2 dozen. It depends on how long that back pain has been there. The longer it's been there, usually the longer it's going to take to fix, because muscles have a memory and we have to retrain them to hold that new position of the vertebrae. So that can take some time. So that's the second most common thing we see in the office. Number 3 would be arthritic change. And arthritis on an x-ray will look like bone spur formation, calcium deposits. Maybe the discs in between the vertebrae are wearing thin and starting to collapse. Usually along with number 3, we're going to get 1 and 2, so tight muscles, restricted mobility, many times shifting in the structure. In this situation, we're probably looking at 90 days worth of care. If you want to have the best resolution you possibly can. If we can restore normal mobility and normal positioning of those vertebrae, then actually we can slow down the progression of that arthritic change, which is usually set in motion by the shift in the structure and the restricted mobility that's been long-standing. So important to keep in mind when we're working in category 1 or 2 that we just spoke about earlier, we're trying to prevent you from going into that third category of the arthritic change. That's why it's so important to keep up with regular spinal adjustments once we get everything back in working order. The fourth most common thing that we see, and probably the most debilitating, are disc injuries. So either a disc herniation or a disc bulge. Most people have heard of a slip disc. They actually don't slip, but what they do is they either swell or they tear. And when they swell and tear, many times they'll irritate the nerves locally, and you might find that you're going to have radiating pain, numbness, or tingling down the legs. These are usually much more difficult to fix. However, they can be fixed. A lot of people are of that misunderstanding that if you have a disc herniation that they're not a good candidate for chiropractic care, but actually in many cases they respond beautifully to adjustments, physiotherapy, muscle stimulation, heat, ice, ultrasound, all these different tools we have at our disposal. And then in a worst case scenario, if it's not responding, of course we might do an orthopedic referral as a last resort. We work with many of the orthopedics in town. Or spinal decompression, which I discuss on another video, may be an option for you too, and that will be based on MRI findings. There are some contraindications that we have to rule out before offering that as an option for you. If you're suffering with low back pain, don't wait too long. We don't want to see you progress from category 1 or 2 into a 3 or a 4. Obviously, when we get into 3s and 4s, care is more expensive and the pain and suffering is much more debilitating. We don't want to see that happen to you. So the consultations in the office are always free. Go ahead and pick up the phone, give us a call. We'll set up a time where you and I can sit down one-on-one. We'll find out which category you're on, put a treatment plan together so we can get you back on your feet. I hope you found this video very helpful, and I look forward to seeing you in the office.